So, what are you and the rest of your colleagues trying to do right now to help save healthcare?
Well, thank you for the question. This is one of those where it's pretty clear where the two sides are. The Republicans made the cuts. So now, Democrats, because we're getting to the end of the fiscal year here in Washington, we have a chance to fight back. It's a narrow chance, but we've got a chance. So we have said to the Republicans, we're willing to confirm a budget so the federal government stays open and is funded after September 30th. But you got to roll back some of those healthcare cuts. You've got to make sure we're not asking for additional spending. And dang, you and I both know we actually need more help in the healthcare system, but we're not asking for that. We're just saying, please roll back the cuts in healthcare that are going to drive up costs for every family in this country. And that's what this fight is about, literally today.
So, I'm an allergist out in the western suburbs of Chicago. And one of my practices in the southwest suburbs called Plainfield has a lot of patients that come from rural areas. Oftentimes, they drive about anywhere between 1 to 3 hours to see me as an allergist.
Wow.
And that's going to become more and more of a problem with these cuts that aren't going to happen right away.
Yeah.
I looked at some of the estimates. There's going to be at least 300 rural hospitals closing over the next 5 to 10 years because of these cuts. And one of the things that I noticed that you may have heard of is that HHS is claiming to put a $50 billion stimulus into rural healthcare, but that's not even offsetting the cuts that are actually happening, right? Can you tell me a little bit more about that?
Yeah. So what happened is that a few months ago, the Republicans decided it starts over with billionaires. They wanted to give a bunch of tax cuts to billionaires, about $1 trillion worth, billionaires and multi millionaires. And they needed to figure out something else in the budget to make that happen. So they're doing about $1 trillion worth of cuts in our healthcare system. And a big chunk of those cuts will come out of what is called nationally Medicaid, but it has different names everywhere you go in all different parts of the country. And this is the part that helps people, helps brand new babies get covered by health insurance. About half of all seniors who are in nursing homes are covered through Medicaid. Your neighbor who has to use a wheelchair or a home health aid, most often covered by Medicaid. And the Republicans just said, yeah, we're going to take that away. And right now, the estimate is just exactly as you said, hundreds of hospitals closing, particularly rural hospitals. And when they close, they don't just close for people who were on Medicaid, they close for everybody.
As rural hospitals close, these patients that come from far away are going to have to drive longer distances to find hospitals in suburbs and in cities, which will increase the wait time for everybody. And the hospitals have to eat that cost. It gets passed on to the insurance companies, which will then jack up everybody's premiums. So healthcare costs will actually increase as a result of the government taking away a lot of this Medicaid funding that is really a safety net, and it, in effect, will not make us healthier. It's going to make us
That's right.
sicker as a result.
In fact, Dr. Rubin, you said it exactly right. The Medicaid cuts are actually scheduled to come in down the line,
Mhm.
but the hospitals already see it. They're already changing their price structures because they've got to. I'm not mad at them. But the insurance companies see it coming because they realize if the charges go up at hospitals, they're going to charge more. So, you know when the costs are going to start kicking in just the next few weeks.
Yeah, to me, as a physician who takes care of red, blue, purple, whatever, it's a reasonable request to be able to help maintain our health
Yeah,
in this country. So I appreciate your work in fighting for that.
thank you. And I appreciate all you're doing. Really appreciate you're getting the word out to people. Now is the time for anybody who's listening to make that call, send that email, send that text, whether you're represented by a Democrat, a Republican, or an independent. It's we are here to represent the people. We need to hear more from people. You have a chance if you raise your voice that maybe we can restore health care for millions of people.